a laughing mother, a busy profession, a grad parent who looks completely at his family. He's fine, he smiles, he talks, and she's always jovial, always feeling okay. Then one day, without much warning, a stroke happens. This happens many times, and I've seen it in quite a number of my clients. This could be a stroke from someone who had no idea that he had blood pressure. It could be a heart attack, sometimes that makes us lose life, or leave someone impaired with the heart failure. Could be heart failure begins at that, kidney failure begins at that point, or life changes, long life for a lifetime. That danger of the heart disease and high blood pressure, they often grow in silence, not much that we can see, not much that we can talk about. Tonight, I want us to change that story. We are looking at how we can be able to reverse heart diseases and how we can keep our heart healthy by taking the necessary lifestyle measures. Hi everyone, welcome to this evening live presentation. I'm Dr. Joshua Derito. I am a family physician focused on prevention and public health. Tonight, you have a practical conversation about protecting your heart, your brain, your kidneys, and your future. Because this is what really matters about you and the ones that you know you love most. If you know someone who have blood pressure, who have ever had a stroke, then raise your hand and let's see on the comment section of those who have ever had this kind of problem. I welcome to this live presentation. Thank you for being with me. Keep letting your comments come so that I know that you are there, and you can also tell me which city or which town you are watching from so that I know where my audience is coming from. Why does heart health matter? Heart diseases can lead to stroke, they can lead to heart attack, they can lead to heart failure, they can lead to kidney damage, sometimes they lead to blindness, and in the extreme unfortunate situation, they can lead to loss of life. The damage usually builds quietly and it builds over time. Nothing magical, nothing to talk about. Silently, you have been going about your business, doing what you enjoy, but inside you, there's a lot that is happening that you are not aware about. The truth I want to reveal to you this evening is that prevention and early action saves lives. So, how do we go about this? And why does this matter? Heart disease is one of the biggest causes of illness and death. This is worldwide and even in our country. It affects families, it affects our finances, our productivity, and even the quality of our life. The moment your heart is compromised, some of the activities that you used to do with me is like walking, doing your daily chores. Then every time you try to train like you're climbing a hill, you start getting overly tired. You try to take a small walk, then it becomes overwhelming. Sometimes you have to stop halfway to take a breath. And sometimes even when this condition gets worse, when you want to sleep at night, when you lie down because of the overwhelm of the fluid, then you find yourself, you have to wake up and sit at night at least to catch your breath. And this can be very overwhelming. The painful truth this evening is many people will only take action when the problem is serious and life is overwhelming them. But usually the heart does not fail in one day. In most cases, the damage builds quietly over months or even years. When we calculate about the risk of someone having a cardiovascular event, we talk about a 10-year risk of getting a cardiovascular event, which could be a stroke, could be a heart attack, could be heart failure, or any condition that is related to the heart. So this does not happen in a day. So that is why prevention is possible, it matters a lot, and it can have a lot of impact. So that is why even screening matters. And the main culprits that cause heart diseases, we are going to see them as we continue. And the only thing that will sort out this problem is you taking action. So the best time and the best way to protect your heart is to do that before a crisis happens. So let's look at some of the silent killers that cause people to have heart diseases. The silent killer. This is high blood pressure. High blood pressure has always been known as a silent killer. Why is this? It has no symptoms. Many people will tell me, I know when my pressure is up, I feel a headache, I feel uneasy. But the truth is, even myself as a doctor, I'll never know when my pressure goes up until I go and take it and get a reading. I know it is normal or it is abnormal. A simple thing that you can do within 5 minutes, you know how your blood pressure is, and as we continue, you'll see how to do to take the blood pressure. So this high blood pressure, it damages vessels, it damages the heart, it damages the brain, it damages the eyes, and it damages your kidneys. And when you come to discover it, most of these problems quietly set in. Your blood vessels are like a pipe of water that is carrying water. As far as water is flowing in the pipes, you will never know that there's a problem in the pipes. But possibly, especially when you used to use the red pipes, when the rust used to accumulate progressively, water would still continue flowing. Sometimes it would be flow slowly. The speed would decrease until at such a time that the pipe is completely blocked. And it's the same thing that happens to our blood vessels. The process of clogging slowly happens. Sometimes, as this is happening, if the blood supply is getting compromised, you may have some chest pain, especially when you strain, a condition that is called angina. That is pain coming from the heart. It will come on and off when you get overexhausted, your oxygen demand goes up. It's not a common occurrence. So high blood pressure is a silent killer because many people will be perfectly okay until the blood pressure quietly and mercilessly destroys your body. No pain, no obvious warning, no feeling that something is wrong. So inside you, pressure is slowly injuring your blood vessels, is injuring your brain, is injuring your kidneys, and even your eyes. Some people occasionally you have some uneasiness, they may have some dizziness, they may have some headache, but these are not cardinal symptoms that I can tell you. When you feel this, know that you have blood pressure. So you only discover it when you have a stroke, you have a heart attack, your kidneys are failed, or you even collapse with a massive heart attack. That will be too late. That will be too late. So feeling fine does not mean always that everything is okay. When do you worry about your heart being affected by other diseases? One, if you are above that, it is very important that you start checking your blood pressure. Initially when I was starting my practice of medicine, I never used to see many patients with blood pressure at the ages of 30, even 40s. If you would see someone with a high blood pressure at 40 or 30s, then that would be something that is very unusual and you would think about secondary blood pressure. Secondary blood pressure is blood pressure that comes as a result of having another condition, like if your thyroid is not working okay, if your kidneys have a problem, if you have an excess of other hormones, like what we call the adrenal hormones excessiveness, those can make you have what we call secondary hypertension. But these days, people in their 30s, people in their 40s, I'm seeing quite a number of them with high blood pressure. So it's not as unusual. So another person who should worry that he could be having a problem, if for any reason you have gone to a health facility, your blood pressure has been checked, and you have been told your blood pressure is high. This might not be something that you need to take seriously, but it's something that you need to think about and see, do I need to keep checking? And the easiest way is, if you can't be able to take it on a weekly basis, at least every 2 weeks, do your blood pressure. And before you do your blood pressure, make sure you are well relaxed. You do not have pressure from wanting to open your bowels, either for urine or long call. You are not anxious about anything, and you are rested enough. When your blood pressure is being taken, you should have a cuff that fits your arm nicely and leaves a good space in your elbow region, which we call the decubitus area, so that you have a space you can feel the pulsation of the vessels there, and then your feet are well rested on the ground, and you are breathing comfortably. You repeat the blood pressure at least every 2 weeks, and if the pressure is high on 2 consecutive occasions, then there is a high likelihood that you have high blood pressure. Then, if you have headaches, you are getting dizziness, you are getting unusually tired, even after a good night's sleep, even you have not overworked yourself, and you have not had a problem with your sleep. But again, also having poor sleep could be an effect of uncontrolled pressure. If you're having sleep issues, then you should think could be a pressure, having a problem, and it needs to be checked. If you feel like your weight is going high and you have been increasing weight progressively, then you need to think, should I be checking my blood pressure? Because again, weight comes with an increase in blood pressure. The more your weight increases, the more likely that your blood pressure will increase. And especially if you have a belly fit. As I have said before, for ladies, if you do your waist circumference and it is more than 88 centimeters, then you need again to start thinking about taking your blood pressure on a regular basis. If you're a man, you have a waist circumference of 102 centimeters, then think about doing your blood pressure regularly. If you have diabetes, then think of monitoring your blood pressure. If you have any stress situation that you are going through in life, then think about checking your blood pressure. If there is a family history of someone having had a heart failure, a heart attack, your family members with hypertension, then you need to regularly check your blood pressure. So this message is especially important for you. If you are over 30, if your blood pressure has ever been high, if you're having headaches, you are feeling episodes of dizziness, you are feeling fatigue, you are having poor sleep, you are feeling stressed, you are gaining weight, you have diabetes, or there's a family history of heart disease or a stroke, you need to regularly check your pressure. And even if you feel completely well, you should still know your numbers. What you don't track, you do not take control. Feeling fine does not mean that everything is okay. Things could be getting out of control. So what are some of the things that might make you think, I need to seriously see a doctor and get a professional advice? If you are having headaches, you are having dizziness, you are, yes, some of the signs that you need to be looking at are: one, headache, dizziness, tiredness. If you have shortness of breath, any chest discomfort, palpitation, you have leg swelling, poor exercise tolerance, poor sleep, sometimes no symptoms at all, but you just feel not okay, then you need to check how pressure is. Sometimes you may not notice everything, but knowing your numbers could be what is going to save you. So always have your blood pressure checked. If not every 3 months, at least once in a year, go have your blood pressure checked. So do not wait for the event before you take the necessary uh, precautions to check your blood pressure. And this will save you a lot of problems. So what is causing this damage to your heart that you go to get heart diseases? One, high blood pressure is one of them. Diabetes is another major risk for heart diseases. Excess weight contributes a lot. Smoking, having too much alcohol intake causing heart muscle problems. Then if your diet is not light, if you're a fan of the ultra refined foods, we are talking about the soft drinks, the juices, the offering most of the refined flours, maize or wheat, too much salt and sugar use, and then inactivity. If you are someone who sits a lot, have no much exercise program, chronic stress. We talk of chronic stress of anything that goes beyond 3 weeks. You feel you are overwhelmed by things. Then you need to check your blood pressure. If you're not sleeping okay, then you need to keep checking your blood pressure. If your cholesterol is abnormal, you need to keep checking your blood pressure. You have poor adherence to your hypertension treatment, then there is a likelihood you are at risk of getting a heart disease. So I have good news for you this evening. How can you reduce your risk of heart diseases? Reduce your salt intake. 2, lose weight. 3, walk regularly. 4, sleep better. When you talk about sleeping better, we are talking about 7 to 9 hours of uninterrupted sleep each night. Of course, you cannot afford this 100%. Occasionally, you may have things that will disrupt you, but that should not be a big thing. Manage your stress. Check your blood pressure often. At least you are saying at least every 3 months. If you have no blood pressure issue, checking it every 3 months would be helpful. Then get support and accountability. Having someone who is following up on your health and giving you update is very helpful. So, why do many people still struggle with heart disease problems? The problem is not the information. The problem is the application. People know what they should do. They know they should eat better. They know they should move. They know they should reduce salt. They know that they should manage stress. But the problem is not hearing their advice. The problem is applying the advice that you get on a daily basis. So how do you apply this? One, you need structure, something that works for you. You need a system, you need support, and you need accountability. And you need to have a very clear plan. What is it that I want to achieve with my health? And that is why I have created something very special to help you create that plan that will help you manage your hypertension. Starting tomorrow, we will have a 30-day hypertension masterclass. This is a practical WhatsApp-based guided program. Tonight, I do not want this conversation to end just like inspiration. You usually go to the hospital, you get inspired, the doctor talks to you, and you feel now is the time to start. But the unfortunate thing, it ends there. Sometimes it is not your problem. It is how our brain has been conditioned. So it is not enough to say that was a good talk, that was a good video, and then go back to the same habit, same confusion, and the same silent disk. We need to be more proactive, and I want to have a plan. So, what is this plan? For the next 30 days, we are going to have this masterclass. I will come into your private WhatsApp, and then I will give you practical guided program. It will help you to stop guessing and it take real control of your blood and your heart health. That is good news. So this program is for who? The program is for people who have been having blood pressure, people who have been having issues controlling their blood pressure, people who have excess weight, people who have headaches, people who have stress, people who have poor stress, and people with diabetes, people with family history of stroke or heart disease, and anyone who is struggling with blood pressure or struggling with weight and wants to create an accountability system. If this is you, then you are in the right place. In this masterclass, what will you learn? Inside these 30 days, you will know what is blood pressure. You will know what daily mistakes people make that sustain their blood pressure. You will know foods and habits that can help lower your blood pressure. You don't know salt, stress, sleep, and movement, how to control them. You don't know the correct way of monitoring your blood pressure. You don't know the medication you are taking and how to ensure that you adhere to your medication. You don't know how to reduce your risk of stroke, your risk of heart attack, your risk of heart failure. And you also know habits that sustain a healthy heart. So this program will make a difference for you. How is it different? One, the lessons are daily. So at any given time in the day, you will think about your health, about your blood pressure. Simple action steps that you can take on a daily basis on your own, practical guidance. You have accountability because I will keep reminding you and you can always get in touch with me. I will give you support and it is also easy to follow. No much of a doing. Make things simple. Make it easy to create time for it. So just possibly 5 minutes and you understand what is happening and what you can do. So do not wait until stroke steals your speech. Do not wait weakness affect part of your body. Do not wait for your kidneys to fail. Do not wait until a point where the hospital bills are overwhelming you. Do not regret that you wish you had done better. So let me be honest with you. These are life experiences that I've had. Some people delay until stroke steals their speech. Sometimes until a weakness affects part of their body. Sometimes their kidneys have failed. Sometimes the hospital bills are overwhelmed. And someone is saying, I wish I. Sometimes you have fear, you have regret because you're presenting with a heart failure. And this is too late. So that is why this masterclass is for you. That is why you should take action before you are overwhelmed. Prevention is kinder than regret. I usually say that prevention weighs cents, but regret is in shillings. It could be in thousands. It could be in millions. ICU care is expensive. We do not want to go that route. Prevention is easier than rehabilitation. I see patients who have been paralyzed on one side, They are trying to get back to action. They are highly motivated, but then it can be overwhelming. So let's start tomorrow. The format will be your WhatsApp account. You'll pay 3,000 for the classes for the 1 month. The number to call or to join with is 0715 965 168, or you can check the Wellness Health Services website. So this is where you start. This is where our lessons will be based, and this is where you take control of our lifestyle issues. Do not postpone. Do not give yourself 30 days, and this could change your next 10 years. So do not let blood pressure take control for you. Take control for it. Start early and stay ahead. Thank you for this live you have joined. I welcome you for the question and answer session. Sometimes I know people are asking themselves, can blood pressure improve in 30 days? They have been working on it lifetime. But the truth is, if you follow what we are going to learn together, then you'll see marked changes in your blood pressure. Can younger people get hypertension? Yes, if you have the risk factors for hypertension, which include having extra weight, having abnormal cholesterol, excessive stress, excess use of ultra-refined food, poor sleep, all these can contribute to hypertension in younger people. Then some people will ask, is medication always necessary? Medication helps you, but what will heal you is your lifestyle. You do not leave your medication for hypertension without a doctor's guidance. Some people will take the dose they were given, they lose follow-up, they stop their medication, and this is risky because, yes, when you are taking the medicine, the pressure could be controlled. But if you are not changed the risk factors that you have, then you have not really sorted the situation, and its risk is still within you. Can walking help? Yes, walking does help, and is one of the recommended exercises that anyone can do. It is easy. It does not require anything. It is life-saving. And for your heart protection, you need at least 150 of moderate intensity aerobic exercise, which could be walking, which could be dancing, which could be swimming, which could be cycling, which could be jumping rope, or anything that will help you move your body in a way. And then also do some strength training. They will help you utilize your glucose even without the need for excess use of insulin. And then, what if stress is my biggest trigger? Yes, for some people, stress is the biggest trigger. But how do you manage stress? There are known methods that you can use to manage stress. One is exercise, ensuring you have restorative sleep, going for therapy if you have issues that are affecting your life, and then doing breathing exercises which you can do for 15 minutes. These help you calm your mind. Your heart is carrying your future. It is carrying your work. It is carrying your family, your responsibilities, your dreams, and your purpose. Please do not wait for pain to start expecting it. Do not wait for a stroke to start taking your blood pressure seriously. Do not wait to regret. Check early, act early, protect your heart early. And if you are ready for support, a clear step-by-step journey, join the 30-day hypertension masterclass today. Again, call or WhatsApp 0715 965 168 or visit the Wellness Health Services website. Just write Wellness Health Services and it will take you to our website. There you can see how to get in touch with us and you can book a call or you can talk to us directly. Thank you very much. Thank you for being with me in this life. So high blood pressure is a silent killer. Feeling nice and fine does not mean that you are always safe. Prevention is cheaper than treatment. The best time to act is before the crisis. Do not wait for an event to take blood pressure seriously. Thank you. We meet in the next live presentation. Thank you and enjoy the rest of